right, let's be honest. If you care about your health, your confidence, and your future as a man, this is a video you can't afford to skip because there are 10 things, some you might be doing every single day, that slowly destroy erections, damage sensitivity, and even put your long-term sexual health at risk. I'm not here to scare you. I'm here to empower you. Because once you know what to avoid, you can protect your performance, your confidence, and your dignity for life. Before we dive in, do me a favor. Hit that like button so more men can see this. Subscribe to the channel if you haven't already, and let me know in the comments where are you watching from today. I love seeing the community of men from all over the world who are taking charge of their health. Your body's warning light. Now, here's a truth most men don't realize. Your penis is like a warning light on the dashboard of your body. When things go wrong, whether it's your blood flow, your hormones, or even your heart, your erections are often the very first place you'll notice it. A weak or fading erection isn't just bad luck or a sign of getting older. It's your body telling you that something deeper is happening. Ignore it, and you might miss the chance to prevent bigger problems like heart disease. Pay attention and you can turn things around. If you're new here, my name is Dr. Lauren Hart. I'm a board-certified urologist, and for the past 12 years, I've specialized in men's health and sexual medicine. I've treated thousands of men dealing with erectile dysfunction, low testosterone, and prostate issues, and I can tell you with confidence, small changes make a massive difference. So, let's go step by step. These are the 10 things you should never do to your penis. And more importantly, what to do instead to stay firm, healthy, and confident. Stick with me until the end because I'll also share a safe, natural way to support stronger erections without relying only on prescription medication. Things you should never do to your penis. 1. Don't ignore changes in your penis. Your penis is the canary in the coal mine of your body. If your erections weaken, it often means your blood vessels are narrowing. The penile arteries are tiny, so they show circulation problems years before your heart or brain does. Biologically, that's why men with erectile dysfunction are more likely to have a heart attack within 5 to 7 years. Emotionally, ignoring this means missing a chance to protect not just your sex life, but your life itself. Practically, if you notice changes, don't brush them off. Pay attention. Don't try dangerous home remedies. I've seen it all. Guys putting apple cider vinegar on their penis, building devices out of bottle caps and rubber bands, or trying extreme stretching techniques. These cause microtears, nerve damage, scarring, and sometimes permanent ED. In my clinic, I've treated men who ended up in the emergency room with metal rings stuck on their penis. Some needed power tools to remove them. Please, if you use aids like constriction rings, only use ones that are medically designed and safe to release. Don't neglect hygiene. This may sound basic, but it's one of the most common issues I see. If you're uncircumcised, you need to gently retract the foreskin, wash underneath with mild soapy water, rinse, and pat dry. Otherwise, smegma builds up leading to infection, inflammation, and even in rare cases, penile cancer. But here's the flip side. Don't overclean. Harsh soaps strip away protective oils and cause irritation. Gentle, consistent care keeps your skin healthy. Don't ignore pain, bleeding, or lumps. This is a big one. Pain during sex, blood in urine, a lump, or an ulcer? These are never normal. They can mean infection, kidney stones, or in rare cases, cancer. Biologically, these are red flags. Your tissues are under attack. Emotionally, ignoring them delays treatment and creates fear in the bedroom. Practically, if you notice anything unusual, get checked. And if your doctor makes you feel judged, find a better one. You deserve care without shame. Don't take risks during sex. Confidence and safety go hand in hand. I can't stress this enough. Penile fractures are real emergencies. When an erect penis bends sharply, the outer tissue tears. There's a pop, immediate pain, swelling, and bruising. We call it eggplant deformity. If that happens, get to the ER right away. Lubrication is also key. Lack of it doesn't mean your partner isn't into you. It could be hormones, medication, or stress. Use lube. It protects both of you, reduces friction, and helps you stay in control. Don't overheat your testicles. Your testicles are outside your body for a reason. They need to stay cooler than your core to produce sperm and testosterone. Long hot tub sessions, sitting with a laptop on your lap, or keeping your phone in your front pocket can raise temperature and reduce fertility and hormone levels. Biologically, heat damages sperm and reduces testosterone output. Practically, just shift your laptop to a desk and keep your phone in a jacket or bag. Don't grip too hard when you masturbate. One of the most common issues I see is death grip syndrome. Using too much pressure conditions your body to need extreme stimulation, making partner sex less satisfying. Biologically, it desensitizes your nerves. Emotionally, it can leave you frustrated and disconnected from your partner. Practically, lighten up, add lubrication, and retrain your body to respond to gentler, more natural sensations. Don't smoke. If there's one thing guaranteed to wreck erections, it's smoking. Nicotine destroys the inner lining of your blood vessels, reducing nitric oxide, the very signal that makes an erection possible. It also raises your risk of bladder cancer, one of the most aggressive cancers we see in urology. Biologically, smoking chokes off your circulation. Emotionally, it steals your confidence. Practically, quitting protects your performance and your future. Don't beat yourself up. Men often link self-worth to performance. But here's the truth. Every man has an off day. If you spiral into stress and anxiety, your brain activates the fight-or-flight system, the exact opposite of what you need for an erection. Biologically, stress hormones constrict blood vessels. Emotionally, it creates a cycle of fear and failure. Practically, remind yourself your value is bigger than one moment. Talk to your partner, talk to a doctor, but don't carry it alone. Don't stop using it. Yes, use it or lose it is real. Erections deliver oxygen-rich blood to penile tissue, keeping it elastic and sensitive. Without them, scar tissue forms, sensitivity fades, and even size can slightly decrease. Biologically, nighttime erections are nature's way of maintenance. If they stop entirely, it can signal deeper issues. Practically, even solo stimulation helps maintain blood flow and tissue health. Intimacy isn't just about sex. It's about connection, confidence, and keeping your body in practice. Your action plan for confidence. So, what should you do? Protect your circulation with exercise and good nutrition. Keep your hormones balanced by managing stress, sleeping well, and addressing low testosterone if needed. Stay safe in the bedroom. Keep hygiene simple but consistent, and treat your erections like the vital sign they are. And yes, if you want natural support for better blood flow, supplements like L-citrulline from watermelon extract can help. Your body turns it into nitric oxide, the messenger molecule that tells your penile arteries to relax and open up. That means better circulation where it matters most. I'll link my trusted recommendation in the pinned comment and description. Listen, I want you to hear this clearly. Erectile problems are not the end of your masculinity. They're not a reason for shame. They're a signal. And signals are meant to be listened to, not feared. I've seen men in their 50s, 60s, even 70s restore not only their sexual health, but their energy, confidence, and relationships. Small steps done consistently make an enormous difference. So, take this as your wake-up call. Respect your body, respect your penis. Avoid these 10 mistakes, and you'll be protecting not only your performance in the bedroom, but your overall health, your dignity, and your future. If this video helped you, please share it with another man who might need it. Hit that like button, subscribe if you haven't already, and drop a comment below. What's one change you're committing to today? I'm Dr. Lauren Hart, and my mission is to help men feel informed, confident, and empowered at every stage of life. Remember, age is not the end of vitality. With the right care, you can enjoy freedom, confidence, and intimacy for decades to come. Take care of yourself because you are absolutely worth it.